what I tend is that I would take you through what you would be expecting during this particular unit. So this unit would aim to develop your essential academic and research skills, which are essential for working in health and social care. And you would be thus able to formally present your academic research findings, which could be written or in an oral form. So the assessment is you'll have certain objectives to achieve, certain learning objectives. So if you would want to achieve a pass, merit, or a distinction, there's certain criteria that you would have to meet. So in order to achieve this unit, you must produce work that demonstrates achievement of the learning outcomes at the standards provided by the assessment criteria. So this is the assessment criteria. So our first learning objective is to understand the role of research and different approaches in health and social care practice. I'm not going through the details of this. I'll go through them once we've covered all the learning objectives. I'm just giving a brief background so that you're aware, it's in your minds that, yeah, this is what you have to focus on. So the second one will be to know how to identify and justify a topic for research. So you've chosen the topic for research. How did you identify it? What are the tools to identify the several research topics? How would you identify a research topic that within the services for health and social care? And then to be able to complete a research project in health and social care. So this is some of your indicative content. So you'll have to explain the role of research in evidence-based health and social care practice. Actually, we'll be talking about all of these. So in today's learning objectives, we'll be talking about how research develops and improves and identifies what gaps there are in practices, different practices in health and social care. This is definitely for promoting health and well-being of the individuals. And then guidance, protocols, policy, practice, safety, duty of care, safeguarding, and current practice. What's the current practice in the NHS particularly? Data collection methods. How are you going to collect your data? What are the ways of analyzing your data? The different theories that we'll talk about. How valid is your data? How reliable is your data? And uses for findings. So if you have certain findings, if you have collected your data, how would you use that? How would you draw conclusions from your data? And what action would you take? So the next would be to identify how to choose a topic, as I've said. So it has different. So this is for tomorrow. We'll talk about this tomorrow. And the first one would be basically for today. And if I stop sharing, I'll share my screen again. I hope that's clear. If anything is not clear, please let me know. I'll just share my screen again. This is again for your assignment. So you must propose and carry out a research project. So it will be a short research project, obviously, because the course is short. It's not a very long course. That should be related to health and social care and explain how research would lead towards a change in practice. You may choose an opportunity or a problem at a health and social care setting, or a current issue in health or social care, and consult with your tutor or supervisor to determine a suitable area for research. So in this, you will be showing critical thinking, planning, organizing, and time management. You'll show your research skills. You'll be gathering information, note-taking, summarizing, analyzing, and all these other points. So we'll help you in this, definitely. But some things that are there that you will have to do it on your own, which we would be expecting you to do it on your own. And this task, the first task is to identify and agree a topic on a research topic and produce a research project proposal. There's certain points that you would have to note down in your research proposal. We'll talk about this. So there'll be ethical considerations, importance of aims and objectives, how did you reach to this project topic, the links between research and evidence-based practice, and analyzing the contribution of research and evidence-based practice on decision making, and you'll have to explain the contribution of research to health and social care provision. So we'll talk about all these details later on. We have a separate session on this. Task 2 will be to carry out a literature review related to your own chosen area of research. So whatever area you choose in the first task, you'll be producing a report and you'll be summarizing and commenting on the literature review and drawing out main themes and issues that have been identified. Task 3, so this is the second one, is a literature review based on your own project. Task 3 will be to carry out research for your chosen area, collecting suitable data, recording the findings. So this will be actually going out and collecting data and then applying data analysis methods also. And then task 4 will be to produce a set of slides and notes for a presentation. So you'll be presenting your findings and your literature review, your whole project in the form of a presentation. So that's about it. Any questions on this before we go to the presentation? Okay, so I'll start sharing my slides. If you have any questions, you have our emails, please let us know. We'll get back to you. Okay. So I hope my screen is visible to you. So the first LO learning objective is to understand the role of research and different approaches in health and research, health and social care practice. I just want to ask you all, is any one of you associated with research? Have you ever conducted any research before, or have you ever had a course on research before? Anyone? Anyone? No? Okay. So I guess it's a no. Okay. So this learning objective number 1, it's going to explain the role of research in evidence-based health and social care practice, how research develops, improves, or identifies gaps, what that are there in practice. So there are gaps in practice, but it's basically research that you do that identifies those gaps in the practices. And what's the value of research in developing cost-effective interventions and promoting health and well-being of individuals? We'll be talking about guidance. What is guidance there for conducting research, different protocols, different policies, practices, safety protocols, duty of care, safeguarding, currency of practice, what's the current practice going on? What are the different data collection methods, different types of data? What are the data analysis approaches? What are the different statistical packages? What is grounded theory? And what is validity and reliability? And we'll also talk about potential uses for finding what findings you have from your practice. How do you draw conclusions from the data that you have achieved or that you have collected? And the actions that future researchers should take as a result of your project or any project, and what are the benefits to the organization as a result of this project. So the importance of research when we talk about this in health and social care, how important it is. So research anywhere in any sector, it informs and broadens your understanding of things before you make a decision. So let's say you want to make a decision about improving waiting timings, like you decrease waiting timings of for patients, you will have to do a research on it and see what are the main factors leading to increase in the waiting timings. This is research that will give you indicators that yes, this is the reason why there's an increase in the waiting time. And then we'll talk about health and care research. Health and care research is the same. So it's health research or care research would be the same potentially. It seeks to identify answers, find answers to certain questions about what options are there available and what are the best options available. So you have several options available. What are the best ones available? Because you have limited resources, isn't it? So you want the best out of your resources. It uses these discoveries that have been made through research in order to make decisions about improvements or changes. So how does it help? We diagnose diseases early and more accurately. Anyone out there can tell me, how do we diagnose diseases earlier or more accurately? How does research help me? Or do we have a tool to identify diseases earlier? What is the term called for identifying diseases earlier? So it's called a screening process. But screening, how do you do screening? Like, how do you screen? Do you screen everyone for a particular disease? Do you, let's say that person has a disease that's very common, it's lung cancer. Do you want to go out and screen everyone for lung cancer? No. So research has said that screening, if it's targeted to the most vulnerable people. So in smokers, they're the most vulnerable to develop cancer, isn't it? And adults as well. So you'll be putting your screening efforts on them instead of going through the whole population for screening children, infants, neonates. No, you will not do that because you don't have the amount of resources. So if there's a smoker, that person will be more likely to be going through a screening test. Same goes for other cancers, other diseases. So we've achieved good to screening and more accurately diagnosing diseases compared to previous years. And this has come through research. So providing life-changing treatments, this has also come through research. So we know that before a treatment gets out in the market, there are certain protocols and procedures that the treatment has to go through. So first you will be doing the treatment in laboratories, and then later on you will be doing it on a smaller population, which is a test population. And then you will go out and start publicizing the treatment, or start that treatment basically goes out in the market. So it cannot go out in the market unless it has gone through all these processes, all these checks. So this is what happened with COVID-19 vaccines. There wasn't any time. It was a threat to the entire humanity. So what was done that there was no time to properly test and trial those vaccines that have to go through years of trials. People were dying, so all they could do was to as soon as possible, as much as possible, and then you have those side effects. You will not deny that those side effects will happen because you've not gone through proper protocols. But then, sorry, the vaccine did save lives, isn't it? So you'll have to see what is beneficial to the entire society. Preventing people from developing certain conditions. These could be conditions, physical, mental, all types of conditions. So this also comes through research, improving health and social care for generations to come, and ensuring everyone has the best quality of life. So the number of years are increasing, but the quality also is improving within those years. So what is the definition of research? It is a process of systematically inquiring or a systematic inquiry, and what would would have within it collection of data, documentation of critical information, and the analysis and interpretation of that data or information, which should be in accordance with suitable methodologies that are set by specific professional fields and academic disciplines. So this will have data collection, this will have data information. So you could collect data in different ways. You could just go and collect data through, you could have second-hand data that is available on the internet. You could do a review on a certain topic, and that would also have data collection. Data doesn't mean that it's collected from individuals only. So you could have a method whereby you're seeing documents, you're seeing research that's been done previously, and then you're noting down and analyzing and interpreting that information that you've got from those articles. So what are research skills? They refer to the ability that helps you to search for, locate, exactly, and extract, organize, evaluate, and use or present information which is relevant to the topic. And then academic research is a type of research. It's a process of detailed and methodological or methodical investigation in some area of study. So as you've said, that you would have to identify a topic of research of your choice, and then you will have to justify why have you chosen that topic of research. This will obviously be supported through us, and you would be actually doing your academic research. So what is research? We talk about the definition, characteristics. So a research would have different characteristics. So you would have data collection, you would have certain protocols that you will have to develop, and those protocols have to be listed down. You will have to have ethics approval, and then you'll have to have people that will have be giving you informed consent, and then you have quantitative research, you have qualitative research, and then we'll talk about what examples there are. So I'll talk about these in detail now. So academic research is a collection of study habits, learning strategies, time management that help students learn and absorb school lessons. This is an example. So we're talking about this research where we collect data on how students study, so that's their studying habits, how they learn, and how they manage, if there are any time management tools that are there to help those students learn and understand what they've had in their school lessons. So many of the students, when they're learning, it's much more than accessing information. So teachers, they include academic skills in their lessons. This is to exceptionally, this is to actually master certain concepts. And these skills not only benefit the students when they're taking their tests, but it can also help them in the future. So there's solid study skills that are essential for college success. So if not had those study skills previously, they are less likely to succeed in their colleges. And for example, learning to balance multiple demands at once is valuable in many different career paths. So why is research conducted? So it's conducted with the purpose to identify potential and new customers, understand existing customers. This is an example of why of certain research if you're doing it on your customers or on your patients. Setting pragmatic goals, developing productive market strategies, addressing business challenges, put together a business plan to identify new business opportunities. So someone as a manager would want to do such a research. So there are different types of research methods. Any idea what these are? I've just spoken about them briefly. Anyone? No? Okay. So we've talked about research methods, the qualitative and quantitative research methods, and they have their distinctive properties and data collection methods. So qualitative data and quantitative data are two entirely different concepts or methods of data collection. You could have one or you could have both, but you would be having either one of these. So if you have both of these, this increases the strength of your data. So what are qualitative research methods? It's a method that collects data using conversations. So if there's a conversation going on, you could have open-ended questions in it. So for instance, if I give you an open-ended question about, let's say, I ask you, what are the difficulties that are faced in the NHS today? And the responses that you give to me would be different themes that are generated. So someone could say, for instance, that the biggest challenge is a lack of resources. The second one could say lack of proper training. The third one could say lack of a proper vision, giving examples. The fourth one could say, like the four of you, the fourth one could say increase in patient illnesses. So there'll be different answers. You could have given the same answer actually, but these, in this instance, I've given to you the separate answers. So there'll be separate themes produced on the basis of these answers. And then we will say how many people said this, what was the percentage of people who said certain statement, who gave a certain statement. There are different ways to document your data, but ideally, this is the way you're doing open-ended questions. So open-ended questions do not have a yes or no, ever, or these options. They don't have these closed-ended questions. These are closed-ended questions that have the participant of the research, like if you're a participant in my research, you would have to answer. So let's say, do you find this session that I'm delivering to you easy or hard? So you have just two options. You would either go for being easy or being hard. So those are closed-ended questions. An open-ended one would be a further question asking that what are the difficulties that you're facing in this session. So this will be, you'll be giving different answers. So the answers could be anything related to my question. So that's an open-ended question. So the responses that are collected, actually, they're non-numerical. They don't have numbers. This method helps the researcher understand what participants think and why they think in a particular way. So, for instance, if I ask you if you found it difficult this session, you'll be just giving me a yes or no, but I will not be able to understand why. If it's a no, if you found it difficult, for instance, if it is a yes, what is it that you found difficult in this session? It doesn't give me a clue to improve my sessions the next time. So this helps a researcher understand what participants think and why they think in a particular way. So there are different types of qualitative methods also. So it's a one-to-one interview. For instance, one of you just spends an hour with me. Mostly it's a long interview. So it's a one-to-one interview that I will ask you open-ended questions. You could have focus groups where you have people, the different people coming, like all of you could have, we could have a focus group discussion within this group, and we could have different, just as I said, that if I ask you a question, and then you'll have you'll be giving me different options for those questions. And then those options obviously will be analyzed, and so it's a focus group that will be focusing on one specific concept. So we'll be talking about those um, th- uh, those we'll talk about that particular topic, but from a group, not just one person. So focus groups, unlike one-to-one interviews, are not. They are also in depth, but one-to-one groups or in-depth interviews are more in-depth. So focus groups are not very in-depth because there's a group of people, they might not have the time, the availability to give you their time. But then one of you might be able to give you or give me your time, and then I might go and do a one-to-one interview with you after the focus group. Then we have ethnographic studies. It's the study of people in their own environment through the use of methods like observation and face-to-face interviewing. So sometimes you have people that are there in the environment, that are there that you're taking some data from them. So you're using, you're observing them, like you're observing their different actions and you're documenting them. And sometimes there's face-to-face interviews also. Then there's text analysis. So this is a different type of research where, so an example of text analysis would be a brand analyzing its customer reviews. So, so there are different reviews that a customer will be giving to you. So there'll be different words that will be repeated by those customers or phrases, and those phrases will be helping you to make patterns. So those patterns will then help you to improve your services. So for instance, if you see a pattern coming up and say you have a pattern repeating in a way that they find it very negative, for instance, the brand, or they find that the brand is too expensive, let's say, and that is repetitively seen in their text or in their opinions. So you'll be then focusing more on that, and then that's going to be your outcome for your research. Case studies, there are different types of case studies that we do. So an example of a case study is an in-depth, detailed examination of a particular case. So you have a case, for instance, a case having hepatitis, a case having dementia, let's say, within the real world context. So you are focusing on this case, and it's a detailed study of subject, like a person, a group, a place, event, organization, or a phenomenon. So they're commonly used as social, educational, clinical, and business researchers. I hope this is clear. Coming towards quantitative methods. So these basically deal with numbers. So in the first option that you had qualitative research. You did not have numbers there. You had open-ended questions there. And then you're making themes out of them. Quantitative methods would be dealing with numbers and measurable forms. It uses a systematic way of investigating events or data, and it answers questions to justify relationships with measurable variables to either explain, predict, or control a phenomenon. So there are different types of quantitative methods. You could have a survey, for instance. So a survey is like giving out a questionnaire with yes or no options. So these will be close-ended. And a survey would be given to all of you, for instance, at the end of this session regarding how you thought this session went. So I'll be asking you questions that would have yes and no options, agree, disagree options. So this is a kind of a survey that you could do. Descriptive research is just describing something. So for instance, if you have they've given me some like from the survey that I've done, I take out percentages that 5% of the students thought that the time that was given was very less, or 10% of the students they found the session really easy, which I hope it is it's true. So this is just describing. It's not going to have any in-depth analysis. So for instance, if I want to see correlational research or experimental research, I would go one step ahead and see where in these descriptions, what is the reason for them saying this? So I'll have to correlate. So for instance, experimental research or correlational research, we could see, I'll give you an example. So there's a research that found out that we were monitoring, I was actually involved in a research study. I'm a researcher by background. So there was a study that was done on the levels of air pollution in a developing country. So it was found out that and we were correlating this levels of air pollution. PM 2.5 is a particulate matter that is really greatly responsible for cardiovascular deaths. So we correlated this with cardiovascular deaths. So we monitored PM 2.5, which is the particulate matter, very small, minute material found in air pollution, polluted air. And we correlated it with, so we saw if the pollution level went higher, how much cardiovascular deaths or how many deaths were we having due to cardiovascular diseases. And to your surprise, I'm sure you will be surprised, the deaths are highest, the number of deaths were recorded to be highest during the weekends. Any idea why that's happened? Any idea why would we have such research findings? Any correlation that you can think of? So this is correlating. You're relating air pollution with cardiovascular deaths, and you're seeing as air pollution levels go higher, cardiovascular deaths also increase in number. Any idea? Okay. So the reason for this was that during weekends, there are more people going out on the roads, because of which they have more transportation. There's you have running engines, you have more air pollution because of that. Okay, there's more pollution because of the standing vehicles there that are stuck in the traffic because of the heavy load on traffic during the weekends. So you have more polluted air, you have more PM 2.5. And then because of that, we had more cardiovascular deaths happening in the hospitals. So more people were going out and eating. It's whatever they've gone out, but they're more prone to develop cardiovascular diseases as a result of this high air pollution. Now, saying this doesn't mean that there are other factors also. So those are different other factors that are called confounding factors. So you might have an increase in age. So a young person wouldn't have that impact, but an older person would definitely. Your family history, if you have a positive family history for cardiovascular diseases, you're more prone to have a cardiovascular event. So this is called correlation, basically. I've talked too much deep because I love research. So it is only valuable and useful when it is valid, accurate, reliable. When you have incorrect results, these can lead to customer churn and decrease in sales. So there are different quantitative methods. So it's essential to ensure that your data is valid. So it's founded, it's logical, it's rigorous, and it's not partial. It is not biased. So you want your results to be out in a particular way. You want to show an impact of your of a particular drug that you've taken out, and you try to minimize negative impact, and you try to highlight positive impact. So that is partiality. So you have to have it very valid. So, and logical, it should make sense, and it should be rigorous and well-founded. So what if you have reports, you show this study showed that this drug is more useful and beneficial, and you just exclude negative part. What implications would that have on anyone, on future research, or on the practice? Any idea? Anyone? Okay. So if you have your research and you've published it, and it's an impartial research, it's highly biased. What happens that the other researchers also go through your research? So the NHS, it depends upon these researchers. Every healthcare practice around the world, they depend on research. So if it's being biased, imagine the harm that could happen because of this partial research or this biased research. How badly it can harm the participants that are there in the future, that you have them based on this research. And then it should be accurate, it should be free of errors. That's well explained, and including required details. So you should have all the required details, but not much more. So that should be there. It should be reliable, so other people who investigate in the same way can produce similar results. So that means that if I do some research that you've done, and I do it in the similar way. So let's say that there's some research that's being done in Nigeria, and I replicate the same research and I use the same tools that you use. I use them to study the same concept in the UK. I should have similar results. Timely. So once you've collected the data, it should be there should be a time limit to that data collection. And that is the reason for this, is that you should have recent research. Now, if you study on, if you want to collect data on COVID-19 and its impact, the vaccine impact, so that has been done already. So it should have been done earlier when the vaccine was launched, not now, after 3 years that have passed now. So, but still research is being collected, but that would have been the best time when it should have been collected. And then complete. So it includes all the data that you need to support your business decisions. So there are 8 tips for conducting accurate research. It's to identify main trends and issues, opportunities, and problems that you observe. You'll be writing a sentence describing each one of those trends and issues and problems, whatever there's there. Keep a track of how often each of the main findings appear. Make a list of your findings from most common to the least common. So you're talking about most common issues that are arising. You're talking about where you're working. For instance, if there's an issue there's several issues that are arising, the most common ones you'll be documenting first, and leading to the least common ones. Evaluate a list of the strengths, weaknesses, opportunities, and threats. This is the SWOT analysis that you do. Prepare conclusions and recommendations about your study. Act on your strategies based on those conclusions. Look for gaps in the information and consider doing additional inquiry if that's necessary. So you can have a second study based on this study. And then review the results and consider efficient methods to analyze and dissect results for interpretation. So what is research in health and social care? This aims to find out new knowledge. So you'll be finding out new knowledge that would lead to changes in health treatments, policies, or care. So you can talk about policies, you can talk about treatments or care, or any other topic that you would want to focus on. So this research would inform and broaden your understanding of things before you make a decision. Health and care research is the same. We've talked about this. So we've talked about this basically, these all terms, and So health professionals already know a great deal. There are still so many questions that need answers. Sometimes the outcome of it just confirms that what we have at the moment and it's the best available to us right now. So what is an example of healthcare? The different examples. So clinical research is also known as a clinical trial that focuses on findings and testing new medicines, medical devices. There could be other medical treatments. So for instance, you're developing a new test for breast cancer, or you're comparing two medications to treat heart disease to see if one works better. So obviously, if the one that you're giving to a person that works better than the other one, you'll then be giving that other the better working drug to that other person who will be called a control. But you will definitely give treatment to both the people, and those treatments should be the best out there. So how research contributes to our NHS? This is a short film that we will see. This is one of the last. So I'll just stop sharing here. I'll share this video with you. Just a minute. Share sound.
Let's imagine what our healthcare was like before it was based on research. This isn't too hard to imagine, for it wasn't that long ago that all medical care was based on folklore and speculation, and for centuries before that on little more than magic and superstition. Our forebears had many questions, but they didn't have the hard evidence that allowed them to answer them, and in turn to make good decisions for their patients. Without clinical research, healthcare is in some ways a guessing game. Of course, with experience, practitioners can learn through trial and error which treatment might be most appropriate, but surely there is a better way. And as well as looking backwards, why not imagine a future where there is no more research? What would medical care be like there? Again, this is an easy thing to imagine, for if clinical research were to stop today, the healthcare of the future would be exactly as it is today. No new treatments, no new ways of alleviating pain or suffering, no new ways to prevent disease. Healthcare would in effect be frozen in time, for it's only through the discovery associated with clinical research that we move forward. Although medical care in the 21st century is remarkable, especially if we compare it even to the recent past, I think we all realise that it isn't perfect. There are still conditions that cause great suffering. There are still diseases that we struggle to treat effectively, and some of the treatments we do use may cause unpleasant or unacceptable side effects. We all want healthcare to progress and improve, both for ourselves and for the next generations. Clinical research is the engine that will drive that progress forward.
Thank you. A minute. Okay, so that's about it. Just share my screen again with you. If you have any questions, I'm happy to answer them. So these are all the references that have been used in producing this presentation. So you have been given ebooks and journals on Moodle for this unit. These are some further readings that you would want to go through. They'll help you in your assignments. If you have any queries, there's learnerwork@ukversity.co.uk. That's learnerwork@ukversity.co.uk. Email us if you have any questions or queries. Submission of the assignment will be done on learnerwork@ukversity.co.uk. So the assignment submission is 2 weeks after the completion of the units and its delivery. So you have enough time. Any questions? Yeah, Esther?
Yeah, the first assignment we submitted, when are we hoping to get a feedback from it? Then secondly,
We're on, yeah,
okay,
yeah. Mhm.
okay, should I go ahead? Hello?
Yeah, I can hear you.
Okay, then secondly, this particular